Whole body CT scans. Now there's a test that sounds reassuring, right? But here's the truth. For seniors without symptoms, these scans often pick up harmless, incidental findings. Little nodules, shadows, or cysts that wouldn't bother you in 100 years. But once they're spotted, the medical machine kicks into gear. Biopsies, follow-ups, even surgery. And let's not forget the radiation exposure, which can actually increase cancer risk. Ironically, the very scan meant to protect your health might start chipping away at it. Now let's talk about cardiac stress tests. If you're not having chest pain or symptoms, this test might do more harm than good. Why? Because aging hearts often show minor changes that are totally normal. But the test doesn't know that. The results can be misleading, prompting angiograms, stents, or even bypass surgeries in people who felt just fine. That road to a longer life can become a detour full of fear, medication side effects, and reduced independence. And how about mammograms after 70? This one's tricky. Yes, they've saved lives, but studies now show that for women without a personal history or symptoms, routine mammograms later in life can lead to overdiagnosis. That means finding slow-growing cancers that would never have caused trouble. But once spotted, they spark intense treatment. Surgery, radiation, sometimes chemo, none of which are gentle on an older body focused on healthy aging. Then there's the PSA test for prostate cancer. It sounds like a no-brainer for men, right? But here's the kicker. Many prostate cancers grow so slowly they'll never affect your well-being. Yet one elevated PSA can trigger painful biopsies and, worse, treatments that lead to incontinence or erectile dysfunction. For what? A condition that might never have harmed you. That's a high price to pay for peace of mind. And here's the common thread between all these tests. They often come from a place of fear, not necessity. As we age, the goal isn't just to live longer, it's to live better. That means focusing on quality of life, not chasing every shadow on a scan. Healthy aging isn't about piling on exams. It's about choosing wisely, staying active, and nurturing that vibrant spark within. So what should we focus on instead? Well, healthy habits, my friend. Things like daily walks, joyful movement, balanced nutrition, and keeping the mind engaged. These are the true pillars of longevity. They nourish both the body and soul. And unlike some screenings, they don't come with side effects, just a little sweat and a lot of smiles. Let's not forget the power of social connection either. A warm conversation with a neighbor, laughing with family, even joining a dance class or book club. These interactions feed the active mind and stave off loneliness, a silent threat to seniors' well-being. When we talk about health, we've got to include joy, purpose, and shared moments. That's where real healing lives. And here's a thought. Maybe the best exam we can do regularly is a gentle check-in with ourselves. How do I feel today? What makes me smile? Am I moving, connecting, nourishing myself? These reflections guide us better than any test. They center us in self-awareness and steer us toward choices that align with our deepest values. Quick pause here. If this is resonating with you, hit that like button and drop a little comment below. Maybe share what healthy habit has brought the most joy to your life lately. And hey, if you haven't already, subscribe for more cozy, science-backed chats just like this one. You see, the real secret to a fulfilling, independent life after 70 isn't hidden in a hospital corridor. It's in your hands, your heart, and your habits. Every time you choose a fresh meal over processed snacks, every time you stretch instead of slump, you're choosing longevity and well-being. And here's the kicker. Those small choices snowball into bigger transformations. They don't just prevent disease. They promote happiness and spark a zest for life that no scan can measure. Let's break a common myth. If I skip these tests, I'm being irresponsible. Oh, my dear friend, that's the fear talking. Being responsible isn't about saying yes to every screening. It's about being informed, asking questions, and knowing what actually supports your health. Trust me, wisdom grows with age. And part of that wisdom is knowing when to say, "Thanks, but I'll pass on that test." You're not neglecting your health. You're protecting it from unnecessary harm. Another thing often overlooked is how stress from medical overtesting chips away at our emotional peace. Waiting for results, worrying about a spot on a scan, sitting through one appointment after another, it drains our spirit. And for what? A tiny finding that may never mean a thing. That time and energy could be spent walking in the sun, tending to a garden, or sharing stories with a grandchild. That's where well-being truly blossoms. And let's talk about something nobody likes to say out loud. The system profits when we're scared. Tests, surgeries, treatments, they're big business. And while many doctors are caring and well-meaning, the system can push unnecessary procedures under the guise of prevention. It's not about being cynical. It's about being cautious, savvy, and committed to your own healthy aging journey. The most powerful act of independence is learning to say no, gently, firmly, lovingly. No to fear-based medicine. No to routines that don't serve you. And yes to vibrant mornings, laughter, creativity, and strength. That's the true exam of life, how well we live, not how often we're scanned. And if you've ever doubted it, let me remind you, your body is wise. Trust it, nurture it, celebrate it. Nutrition plays a massive role here. Simple, wholesome meals packed with color, think leafy greens, berries, whole grains, nuts, are medicine for your cells. They reduce inflammation, protect the heart, and support the brain. Plus, cooking and sharing meals becomes a beautiful ritual, one that fosters community and reinforces that health isn't just clinical, it's cultural, emotional, and personal. Exercise doesn't mean marathons. It means movement, joyful, intentional, sustainable. A morning stretch, a slow dance in the kitchen, a walk around the block. These moments pump fresh oxygen through your body and boost mood in ways no prescription can. They keep joints fluid, muscles strong, and minds alert. It's the foundation of both longevity and happiness. Let's not ignore the magic of learning something new. Picking up a language, a puzzle, even a new recipe. It keeps the mind sharp and the spirit youthful. An active mind is a resilient mind. And a resilient mind navigates health choices with clarity, not fear. That's the kind of strength that leads to a long, meaningful life. And if you've faced a tough diagnosis before, you know that real healing starts within. It starts with hope, with courage, with choosing presence over panic. Medical tools have their place, but they should never eclipse your inner compass. That's where the real guide to quality of life resides, in the quiet knowing that you are more than your medical chart. Before we go on, if you've been nodding along, consider subscribing for more gentle, eye-opening conversations like this. Or drop a comment with your favorite way to stay active, whether it's gardening, dancing, or just a good walk. Sharing keeps us connected. And connection, that's the heartbeat of healthy aging. There's also something so liberating about reclaiming your time. Those hours spent in waiting rooms, stressing over test results, or recovering from unnecessary procedures, they can be transformed into moments of joy. Imagine swapping that stress for painting, bird-watching, or sipping tea with a friend. This is what choosing quality of life looks like. It's intentional, simple, and oh so rewarding. And let's not forget sleep, the unsung hero of longevity. As we age, good rest becomes even more critical, yet it's often disrupted by anxiety, sometimes caused by medical uncertainty. Creating a peaceful routine, limiting screens before bed, enjoying herbal teas, or reading something light, these habits restore both body and mind. A restful night is a gift to your heart, your immune system, and your overall well-being. Hydration, too, is underrated. Many seniors underestimate how dehydration sneaks up on us, especially when medications affect thirst. But water is life. It cushions joints, boosts brain function, and aids digestion. A simple habit like keeping a water bottle nearby or infusing water with mint or citrus makes a world of difference. That's longevity in a glass. And speaking of habits, let's give a shout out to mindfulness. Deep breaths, quiet reflection, even just sitting in nature. These small acts reduce blood pressure, ease chronic pain, and soothe the mind. Mindfulness gently teaches us to listen to our bodies and to embrace the present rather than fret over the future. That's a vital part of healthy aging. Now, some folks worry they're being irresponsible if they question standard medical advice. But here's a truth bomb. Responsibility means advocating for yourself. It's asking, do I really need this test? What are the risks? Will it improve my life? When you take the wheel, you're not avoiding care. You're making space for care that truly serves you. Think about it. If you're eating well, moving daily, engaging socially, sleeping soundly, and managing stress, what more could any test tell you? These foundational pillars support not just physical health but emotional resilience and independence. You don't need a scan to confirm that you're thriving. You'll feel it in your bones, your breath, your smile. We've seen too many elders pushed into a cascade of interventions that left them more fragile than before. It often starts with, just to be safe, and spirals into weeks or months of recovery, side effects, or even regret. But there's power in pausing, in asking, what's the rush, what's truly best for me? That's not rebellion, that's wisdom. Of course, if you're experiencing symptoms, or if something feels off, absolutely speak to your doctor. This isn't about avoiding medicine, it's about using it thoughtfully. With age comes complexity, and every choice should be guided by context, not cookie-cutter protocols. You deserve care that sees you as a whole person, not a checklist. So, don't be afraid to bring up your concerns during appointments. Ask about alternatives. Clarify what happens after a positive result. And if your gut says, this doesn't feel right, listen to it. That intuition you've honed over decades is worth trusting. After all, nobody knows your body better than you. If this perspective has opened your eyes even a little, go ahead and give the video a thumbs up. Maybe share it with someone who's feeling overwhelmed by medical decisions. And remember, every step toward empowerment is a step toward better health, deeper happiness, and a more independent life. Now let's imagine a different kind of health plan. One that starts each morning with intention, not intervention. Maybe it's stretching with the sunrise, savoring a colorful breakfast, or tending to a beloved plant. These aren't just activities, they're rituals of self-respect. They whisper, I'm alive, I'm vibrant, I matter. And that mindset, it fuels healthy aging more than any machine ever could. There's also great value in storytelling. Sharing your experiences, your trials, your triumphs, helps others navigate their own path. Whether it's a neighbor, a family member, or a community group, these conversations plant seeds of courage and connection. And as we share, we heal. We remember that we're not alone in our worries, and we celebrate how far we've come. Laughter might just be the best medicine they forgot to prescribe. Laughing releases tension, boosts immunity, and strengthens bonds. So go ahead. Watch that silly movie, recall that hilarious memory, or share a goofy joke. These little sparks of joy aren't distractions, they're anchors. They remind us that well-being is as much about the spirit as it is the body. Let's keep the conversation going about independence. It's not just about walking unassisted or driving yourself. It's about making your own choices, choosing your rhythm, your meals, your priorities, and yes, even choosing not to undergo a test that doesn't align with your values. That's real freedom. That's real health. And here's something powerful. Embracing age as a badge of wisdom, not a burden. You've lived, loved, learned. You've seen the world change. Your voice is valuable. Your decisions matter. So when someone tries to push a one-size-fits-all approach to your health, don't be afraid to say, I've earned the right to decide what's best for me. Remember, medicine should support life, not interrupt it. Every time you say yes to a daily walk, a hearty laugh, a moment of quiet peace, you're saying yes to vitality. You're building a life not around fear, but around intention and joy. That's the path to real longevity. So next time a doctor suggests a routine screening, take a breath. Ask why. Ask what happens next. Ask how it fits into your vision of a good life. You're not being difficult. You're being thoughtful. And that's what creates a future full of well-being, independence, and happiness. Our greatest strength lies in knowing ourselves. When we honor our rhythms, trust our instincts, and focus on what truly matters, love, movement, nourishment, connection, we create a kind of health that no scan can measure. It's deep, rich, and enduring. Just like you. Now here's a little reflection for you. What's one habit you can let go of and one you can embrace that brings you closer to a life you love? Think on that. And if this video sparks something in you, subscribe, hit that notification bell, and drop a comment below. I'd love to hear your thoughts and maybe feature them next time. And hey, if you're hungry for more empowering insights, stick around for the next video. It's all about the most underrated everyday habit that boosts brain power and mood. Trust me, you won't want to miss it. Let's keep walking this path together toward a longer, fuller, and happier life.